We are at the Huey Hospital here in Haiti.
I'm reporting from southern Lebanon.
It's day 3 now of the Zimbabwe cholera response.
I've been here for 4 months.
It's been quite a challenge today.
Today was really a hot day.
There's all kinds of hiccups all the time.
It's very emotionally draining to be here. It's physically draining too.
We've seen hundreds and hundreds of patients a day.
It's been pretty hardcore, actually.
But people are working cooperatively.
I love the team that I've been working with.
Mentally, physically, exhausted, but feeling that we did good things, so I feel happy about that in a way.
International Medical Corps was founded in 1984, and it was started by a volunteer physician. He went to Afghanistan and started the program there. Now we're in more than 30 countries. We have worked in more than 50 countries throughout the past 25 years, and we're growing.
What I really love and respect about International Medical Corps is we are committed to getting assistance to where it's needed the most. And we are not afraid to put all other considerations aside and make sure that the people that need that assistance are going to get it.
At International Medical Corps, we have the Emergency Response Unit, and they monitor emergencies round the clock.
We're the best at what we do. You're going to be part of a rapid deployment team who's well-trained, they're adaptable, flexible, they've done this many times before, and they know how to get the aid to where people need it the most at the time when they need it the most.
Our emergency response team, our logistics team, is able to move so quickly in the face of a disaster and get into the most remote places and do it well and start delivering services.
Haiti, 22 hours. Japan, 48 hours. Lebanon, 36 hours. First in Libya before the National Transitional Council was formed. Darfur, 72 hours. Banda Aceh, 24 hours. Zimbabwe, 18 hours. Mozambique, 36 hours. Chile, 48 hours.
International Medical Corps in emergency situation provides a variety of programs that address emergency needs of the affected populations.
One is primary health care, and oftentimes that's where we try to root a lot of our medical programming in because it forms a basis for all the other services that we provide.
A big project we're doing at the moment, which is actually potentially moving a mobile field hospital, which is 20 plus tons, 52 plus £1,000 worth of equipment, which is the equivalent of 1,000 people's suitcases.
It's a self-contained, self-sufficient field hospital that can provide immediate surgical and emergency trauma care. And as I said, it's self-contained, so it doesn't take anything away from the local resources that may or may not exist at the time period.
The key thing that sets International Medical Corps apart from other organizations that are responding in an emergency is the fact that we start providing training as soon as we hit the ground.
Capacity building with International Medical Corps is essential from day one when we're deployed. You, as an emergency responder, you set the tone for the rest of the emergency response through development.
And that very much is in line with our mission, which talks about relief to self-reliance. So the self-reliance starts from the very word go.
Other groups do good work. They will go in and provide services and so forth. But International Medical Corps, our niche is training, self-reliance, leaving something behind. That's our niche.
Whenever International Medical Corps withdraws from the crisis area, there's always something left behind.
It's about providing a sustainable solution. We're not just going in and delivering services, we're going in and training people so that they're better prepared to help and to respond in the future.
You understand? We can discuss it more.
When you think about the scope of this and you say, am I up to this? And you say, then you can honestly say, no, probably no one's up to this. But you have to go in and do the best that you can. And that's what everybody's doing, and it makes a difference.
Going out into the field is always scary, but you're ready for it. You're mentally prepared for it. And you take it as it comes. You're there to do a good job and to work and to help. And so that's the priority. That's what you have to focus on.
You do have to think long and hard if this is the job for you. Yes, it will be stressful, the conditions will be basic, the hours will be long. It is an amazing thing to experience, and I think everybody who works in this industry will say that it is life-changing. And if it's not for you, it's not for you. It isn't for everybody, but it will change your life.
You can also expect good camaraderie with the International Medical Corps team that is out there. Again, long working hours, but everybody is in it together.
As challenging and as difficult as it was, and at times you thought maybe you wouldn't make it through, you look back and you think, goodness, when am I going to do that again?
We understand that we're giving you a lot of information right now, so don't concern yourself too much with that, because we're here to answer any questions that you might have. And when we get to the field, our field teams will be with you every step of the way.
I mean, it really made a difference today.
We saved lives today.
We are looking forward to tomorrow.
Even in the midst of all the tragedy, it was amazing rewarding.
I feel like we did a lot of good work, and I'm happy we came.
That's all for now.
That is it for today.
I'm actually too tired to talk anymore to you.
See you later.
I'm not supposed to talk about work stuff today. I'm supposed to be laying low and resting. Thanks very much. Bye-bye.